under the old law, how we would go from numbers in just Nassau County of $900 a year to $1,500 a year, an enormously costly enterprise, something really out of in keeping with the actual cost of the insurance company. So what we have done is said, by continuing under the parent's policy up to 25, so long as you're unmarried, you'll get nothing. It will not cost anything. Now, it does cost a little bit, and that's why we have said it's up to the insurance companies to opt into this. And a few have done so, and we're hoping that because of today's news, we'll get more to opt into it. And to illustrate some of the problems that are out there, what I've done is asked Andrew, who is a student here at Hofstra, but working full-time at night, so he gets health insurance that way, to talk a little bit about the problems of being young and having to get insurance. And then Mr. Greg Blair talking about his son, who had to leave school because he wanted to do some work, and until he got covered by the work, there was no insurance in the middle. So, Andrew.
My name is Andrew Sikora. I started here at Hofstra University in 2002, and a couple months before that I started working for UPS in the union as a loader. I worked as a loader for about 2.5 to 3 years, and was union, and I got benefits, and made a nice check every week. But I eventually got promoted into management, and I get a little bit better benefits right now. But the problem always was taking 6 classes and then working full-time hours at night, working from 5 to 11:30, 11 o'clock at night, which is physically, mentally, and emotionally draining on a 23-year-old college student, because it's not exactly easy to go to college here at Hofstra and also work full-time hours when everybody and all of your friends are going out and partying at night and sleeping late in the morning. But it's definitely not easy, and there have been many times that I've wished I could just leave my job and pursue, more so the career that I want to for radio broadcast. So it's kind of been a juggling 3-ring circus between work, internships for my career, and also school. But I think this would be a great thing for not only myself if I ever decided to leave my job, or to, if I lost my job, if I wanted to pursue something else, that I would be covered without having to pay $800 a month. And I think it's also great for people that are younger than me, that are going to be coming up and not realizing the great cost of benefits and health insurance. And it's definitely not easy, and I think this is a great thing for all the younger people, not only at Hofstra University, but all over.
Andrew, could you just spell your last name?
Sure, it's S-Y-K-O-R-A, Sikora.
Mr. Blair.
Yes. My name is Greg Blair. My son Ryan Blair is a 22-year-old senior at Fairfield University in Connecticut, who is now in New Delhi, India, on a 6-month internship. Ryan had this wonderful opportunity presented to him, and it was the sort of thing that was too good to pass up. So he's interrupted his education and has, to every parent's nightmare, decided to switch his major as a consequence, which means that he'll be in school for an additional 6 months beyond the 6 months that he had left to complete. This bill eliminates uncertainty on a number of levels. If I were to leave the decision up to my 22-year-old son and say, this is your financial responsibility, I know the answer would be that he would opt out, roll the dice, and say, I'm healthy, and I don't believe that I'll suffer a catastrophic event. As a parent who cares very much about my son, it ultimately would be my financial responsibility. So in addition to paying tuition, in addition to assisting him in providing for all of his means in all other respects as a dependent child, and he still is dependent until he is on his own, I am forced with the double jeopardy of also having to insure to cover the cost of insurance for him. I also feel that this bill is a tremendous benefit for myself and all taxpayers in general, and all consumers of health care. Because every person who opts out, every young person who opts out because of an affordability issue, or whose parents can't afford to pay the COBRA payment, notwithstanding their feelings about how beneficial it might be, they are a potential burden on the healthcare system as an unpaid liability. The 23-year-old who says I can't afford it and my parents can't afford it and rolls the dice and experiences a $500,000 or $1 million illness that may never be repaid is a burden on the system, a burden on the financial health of the system. So we're very grateful state senate for passing this law, and we hope that the insurance companies comply and sign up. Thank you.
That's a first. That's a first. I've never.
I don't know what I did to elicit that response.
There are 1,175,000 New Yorkers who are between the ages of 20 and 24. When we start to talk about the number of uninsured, this is the target that we are trying to address with this provision. There are some companies who didn't know if they could offer this because of the old law. There were some companies who are offering it, but only if the employer asked for it. Then there were some companies who are offering it only through their HMO product and not through their indemnity product. So what we're trying to do now is build less and less holes in the healthcare protective network that is out there for New York. And I think this bill will do one of those things, and I thank you very much. Questions?
Any questions? Okay.
Thank you.
Thank you.
Well spoken.